It says,
Okay, and I believe we are live. It says we are now streaming on Facebook. So, gentlemen, thank both of you for joining us. Hello to everyone who is watching. Joining me now is Dr. Jose Rodriguez and Dr. Danielle Colon Ramos. Dr. Rodriguez heads up the Puerto Rico Public Health Trust. Dr. Colon Ramos is a professor at Yale University. He's a neuroscientist, and both of these gentlemen were born and raised in Puerto Rico. I asked them to join us because there's some really good news. And even though I tell you I want to share good news all the time, I mean it. And this is one attempt to do it. When it comes to coronavirus testing, Dr. Rodriguez, why don't you tell everyone what the latest results are and where the island is on testing? And Danielle, we'll get to you on how that compares to the States. Dr. Rodriguez, go ahead.
thank you for the invitation, David. Here at the Puerto Rico Public Health Trust, we have been working with 6 different clinical reference labs in Puerto Rico, where we started meeting together 6 weeks ago. 6 weeks ago, we could do only 200 testing of molecular testing per day. And after that, we were increasing slowly, but the past 2 weeks have increased dramatically. And last week, we have more than 2,200 tests per day. So that's great news for Puerto Rico. We are still increasing the numbers of testing per day. We hope that for this week, we can reach the 3,000 tests per day with these different labs. And also, the reach or the goal that we have is for at least 4,000 tests per day.
Danielle, this is significant. How does more than 2,500 tests per day compare to what's being done in the States?
Well, David, it places now Puerto Rico, if you compare it to the other states, it was dead last, and by a lot. A few weeks ago. Right now, in terms of total numbers of tests, that means that Puerto Rico, and let me just make the distinction here that we're talking about tests made only by the private laboratories that form part of this coalition that Dr. Rodriguez Orengo has helped nucleate. So these are only 6 labs. These are 6 big private labs, but we're not counting the results from the Department of Health because we don't have that data. We do have the data from the private labs. And counting only those labs, they have done over 40,000 tests, which places Puerto Rico number 41 among the US states and territories. So from that last to number 41 is still not in the top 20, but it's pretty good. And I just want to explain the significance of what Dr. Rodriguez Orengo was sharing in that you have to consider that a few weeks ago, what we were hearing when this coalition of labs were formed, it's a collaborative coalition between these clinical laboratories and scientists to try to identify and overcome every barrier that they face to do as many tests, molecular tests as possible to increase the diagnosis in Puerto Rico. When we formed that coalition, what was said in Puerto Rico publicly and privately was that Puerto Rico, it will never be able to break more than 1,000 tests a day. Right now, only these private labs are doing over 2,500 tests a day. That's a 10-fold increase from what they were doing before they started collaborating with the scientists, before they came together to exchange information, and it's greatly benefiting the people of Puerto Rico.
When talking about testing for everyone watching, we are specifically talking about PCR testing, which is the official test, the best test, arguably, that you use to determine positive or negative. There is another test that you've heard of, the rapid test, that is used to determine whether or not you've had coronavirus in your system at any point in the past of any coronavirus, not just COVID-19. So Dr. Rodriguez, help everyone understand the journey of what it's taken to get to this point. If you could do it today, why wasn't it doable in March?
What happened there is that there was a lot of barriers that we need to overcome because the materials and the that we needed to make sure that these labs were not there. Also, some of the testing that was needed was not bringing the information or the situation of the different labs in the states that were collaborating with us. We did not provided us with the environment to make this testing possible.
And by the way, the question is not a criticism for everyone watching. It simply is an explanation and an understanding of what it took to go from there to this point. Danielle, you were telling me earlier before we got on and started doing the interview that 4 weeks ago they were doing 50 tests. Can you further elaborate on the barriers that existed? I mean, you and I have been talking for the last several weeks, and it seemed like every day or every week there was a hurdle that Puerto Rico had to jump through. And namely, one of them was even getting the number of tests that you needed to actually conduct it, because people were worried that Puerto Rico wasn't getting a fair shake and that they weren't being prioritized compared to the states.
Look, David, to do this test, you need a number of ingredients. And some of them Puerto Rico had, and some of them Puerto Rico did not have. So you need the people that are prepared to conduct the tests. And we have that capacity. You needed the machines to be able to do these tests. And these clinical laboratories, this coalition had that capacity also. You need the certifications, both federal and local certifications, to be able to conduct these tests. And these laboratories had them. So we got them together and we said, why is it, if you have the personnel, if you have the machine, if you have the certifications, why is it that we're not conducting more tests? And they started identifying problems that, frankly, some of the problems were problems that were being faced globally. But the attitude at the time, I think, from the central government was just to wait for somebody else to solve them, like the CDC to come over and solve them or something. And we said, no, we can create a coalition between the scientists and the clinical laboratories and start hacking and finding solutions to each of the barriers that they're facing. And just to give you a few examples, for example, the clinical laboratories early on had difficulty getting the solutions, which are these liquids, into which you put the virus, because there was a shortage. There was a global shortage of those solutions. So the scientists looked into the components that are used to making those solutions and said, we can make these solutions ourselves and we can supply them to the laboratories so that the testing can continue to go. So another example that I like to give is that early on, you needed to have samples that from people that had COVID. So those are called positive controls, which enable you to know that you were performing the test correctly. So you needed to have, it's like an answer key. You need to have the answer key to know if you're doing the test right. But because COVID was new to the world, we didn't have that answer key in Puerto Rico. So we used the network of scientists that we had, and we were able to get that answer key for the clinical laboratories so that they could implement then the tests. And one by one, we identify each of the barriers, and by creating coalitions, by creating alliances and collaborations, we were able to overcome them and increase the testing capacity, again, tenfold just in the private labs.
Jose, let me ask you this. Is it even fair to expect that the government can be doing as much as the private sector is doing right now?
No. The public sector has the capacity to do testing that is needed for certain population in Puerto Rico, like first responders. But the capacity that we have with the private labs is much more. And that's where we need to expand the testing. Right now, we are looking for other ways of collecting the samples, because we know that the swabs, and if you have done the testing yourself, you know that it's uncomfortable to get the samples through your nostrils. Now we're working with saliva. So we're looking for answers and collaborations. You know that there's Rutgers University has provided some methodologies to do the saliva testing. So this afternoon, I'm going to be talking with scientists from Rutgers to bring that technology to Puerto Rico in order for us to increase more the sampling that is better for patients and the security of the people that are taking the the sampling is much.
So the ones that's being done in Puerto Rico right now are the ones you got to stick all the way back in the head.
That's right.
Right.
And we're looking for alternatives to be safer, not just for the patients, but also for the people that are doing the testing.
Jose, why don't you show the audience watching right now the graphics that you showed me earlier and explain what they represent?
Yes, let me do this right now. Let's see here. I guess that you are seeing now the graph that we have on screen. And again, this is a collaborative between scientists from the Puerto Rico Public Health Trust, Ciencia Puerto Rico, and also scientists from UPR and the Ponce Health Science University. And here you can see clearly that when we started meeting with our colleagues in March 29th, the average per day of testing that we have was less than 200. And within a few weeks, you can see here now that last week we surpassed the 2,000 testing per week. And you have seen this before. This is like the virus that is increasing. So we are almost using the same exponential increase of this of doing testing in Puerto Rico. We expect by this week we can reach more of the 3,000 per day, and hopefully in 2 weeks we will reach our goal that is 4,000 per week.
If you were to reach, and I know you have another slide, but let me ask a question. If you were to reach 4,000 per day, Danielle, where would that put Puerto Rico in comparison to the States? Not that it's a game of comparison, but like everybody talks about Puerto Rico being last, and this is significant.
No, I actually will make a comparison right now with the amount of tests that are in that graph. So we know, for example, that this past week, so this goes to, the last data point here is the 10th of May, and we know that on the 20th, we were at 2,720. So already we're off that graph by a couple of hundred as of the latest count. What does that mean? That means that per every 1,000 inhabitants, we're doing 0.85 tests, which doesn't sound like a lot, but to put it in comparison with other countries, for example, in Canada, they do 0.69. So we're doing 0.85. In Canada, they do 0.69. In Chile, 0.62. In Italy, 0.53. In South Korea, which has been an example, 0.14. So this places Puerto Rico among the territories, countries, and states that are doing the highest number of tests right now per capita. So for our population, which is 3.2 million, that means that we have now broken a barrier that was preventing us. That barrier that you see right there in that graph as 500, to which there's a plateau before, that represented all the barriers that were holding us back. And we have broken that, and there's an exponential growth. And that will place us, right now, I was telling you earlier, that we're number 41 in terms of total numbers of tests. But soon we'll be able to be in the top 20 if we continue this rate of testing.
Jose, why don't you show everybody the second graph you have?
So in the left-hand side that you see the same graph that I presented in the previous slide. And in the right-hand side, you see the percentage of positive cases that we are seeing per week. And as you can see, the percentage of positive cases have been decreasing since we started doing the testing. And right now is around 3% of total percentage of positive cases. Last week, if we could take only last week, it was around 1.1% of positive cases. So this is very good news.
Yeah, it is. What explains this downward trend?
I guess at the beginning, we were concentrating in symptomatic individuals only. And of course, you would find most of the positive cases. And right now, we are increasing the population that we are testing, and therefore the numbers are decreasing.
Are you now in a position that the public health sector, the private sector, is testing people who are asymptomatic?
I think so. Usually that would happen when we're opening the economy of Puerto Rico, and we should do it in this way of doing molecular testing prior to opening the facilities. We have done that in one facility that we do clinical trials here in Puerto Rico, and we did today all 30 employees molecular testing in order for us to continue doing our work. So
David,
yeah, go ahead.
now, I was just gonna say a few things that graph tells you and does not tell you. Like the graph, this is data that you can bank and you can take to the bank. This is data that you can trust, because this is data that's coming to us directly from this coalition of private labs. Again, this doesn't include the data from the Department of Health. It would be great to bring those data sets together and have the same level of granularity that we have here for that other data. But the second thing is, like, it tells you now confidently, because you're doing enough tests, that the percentage of positive cases that you're seeing are actually decreasing in Puerto Rico, which is good news. But it's not the end of the story. So I wanna give a sovereign also warning about where we are and where we should be. So where we are is right now in Puerto Rico, we have enough molecular PCR tests, which are the diagnostic tests, for people to be able to really do the diagnostic in the right way, instead of using serological, like rapid tests, which do not tell you if you really have the virus. So that's message number one. Message number two is that these like hills, these peaks that people keep on talking about in the epidemiological curves might come as the economy reopens. And the use of these tests will allow the people of Puerto Rico to know what's going on. So we're not by any means claiming that now the virus is gone. We're just saying, look, this is what science allows you to do. By using science, by using knowledge, by using evidence, you can make more confident statements. You can create coalitions to defeat barriers to begin with. Second, you can make more confident statements about where you are, so that you can have good planning in terms of reopening, in terms of what you want to do with the society. But it's important. The reason that we can make those statements is not only because we can do the test, but because Dr. Rodriguez Orengo, in creating this coalition, he was able to secure the data from these labs. So he now has the data from these different labs that allows us as a community to look at just that data, which is only the private labs, and say, okay, this is how we're doing. So the Department of Health needs to set up similar systems that allows to look at granular and trustable data, so we can make correct policy and epidemiological projections and protect the people and the health of the Puerto Ricans.
Dr. Rodriguez, if I were to go to the state's website, and we say the state, and I realize that people in Puerto Rico are very sensitive about saying we are not a state, but you should know that in technical terms, the way FEMA refers to it, the way the federal government, they'll often refer to the central government, the island government, as the state. So the island government, if I were to go to their website, would I see the number of tests that you all in the private sector are doing, or no?
I think so. I don't know. I'm really the information. I don't really. I don't look at the data from.
Danielle, do you know?
From that.
I don't know. I don't know the data they're displaying there. It doesn't. It's not the data that we have.
Are you contributing the data you have to the department? Are you making them aware of the numbers?
I mean, the labs themselves, they provide the data to the Department of Health. So okay. they need to, and they do it diligently. I mean, they do it daily, and they provide all the information to the.
I think the problem that they think to understand, David, is like how they use this data. So, for example, one of the problems that they had was that they didn't have the total numbers of tests earlier, like a few weeks ago. They only had the people that tested positive, so you didn't have the denominator in that equation. You only had the numerator, the positive cases. So that doesn't allow you to really interpret the data in the way that you need to. So while this data should have been reported to the Department of Health, how the Department of Health is processing that data and reporting it to the public is something that we cannot speak to. But we can speak to the quality of the data we're presenting here.
Well, look, this is significant. And gentlemen, I thank you. I don't want to take too much of your time, but congratulations also. Danielle, I watched you try and get people on the phone to basically take the assistance of what y'all are offering. And Dr. Rodriguez, you obviously have a more than respectable coalition that you run. And so my congratulations to all of you.
Thank you so
Thank you,
much.
David. Thanks for
All
giving
of
us
you.
a voice.
Before we go, the final word is yours. Is there anything I didn't ask that you'd like to add?
At least from my part is that right now in Puerto Rico, we have the capacity to do molecular testing. So doing the rapid testing is no choice for me. Therefore, we should forget about the testing and we should concentrate in the molecular testing for now. There's going to be some antibody testing that is coming real soon to Puerto Rico that is more reliable than the one that we're using right now.
Danielle?
I think this is a marathon. I'm glad that this first lab, we were able to run it together as a coalition, of labs and scientists. I'm very proud to have been part of that. And I second what Dr. Rodriguez Orengo said in terms of the serological rapid test. I don't think they have any place in diagnostic purposes. They might have a place in census or epidemiological studies, but not diagnostics. They shouldn't be used that way. And I hope that we have presented the data that we actually have the capacity to do this test, and we should be doing more of this test to protect the health of the Puerto Ricans.
Danielle Colon Ramos and Jose Rodriguez, thank you both for coming on to share the great news.
Thank you, David.
Thank you. Thank you, David.